Obamacare and how it compares to Canadian healthcare. Presentation by Kristopher D. Masilamani at the University of Alberta, Faculty of Medicine and Dentistry. This presentation will go over what Obamacare is, the policies before and after, compare it next to Canada, identify several issues, give plenty of scenarios, and conclude with the reference slide. Just a brief history on the United States healthcare system. Before the 1920s, there was barely any system in place, but as medicine advanced, treatment costs went up, and the Blue Cross and Blue Shield came about and allowed people to pay for their medical bills. In the mid-1900s, commercial insurance companies also started popping up and supplied health care to those who need. Employers were also encouraged to provide health care to their employees. Between the 1970s and the 2000s, medical costs have only continued to rise. Americans have strived for the perfect healthcare system, looking to model countries like Canada and Sweden. However, the states have a larger population and a large gap between its financial classes, and the increased use of privatization makes it hard to have an efficient healthcare system. So to start off, what is Obamacare? Obamacare is actually termed the Patient Protection and Affordable Care Act officially, and is basically a set of revisions to America's current healthcare system. The ultimate goal being to get the uninsured insured. So before Obamacare, there were multiple issues. You could be denied care, especially if you were a woman because care is more expensive, or if you had already been sick. Your care could have also been interrupted, especially if you filled out a form incorrectly. Appealing your insurance company could have been unsuccessful, and altogether 46 million Americans were uninsured before Obamacare. Obamacare brings about new benefits, rights, and protections, as well as the inclusion of an insurance marketplace, which is a virtual marketplace where Americans can log on and have access to all sorts of insurance companies who compete against each other for customers. Medicaid is expanded and Medicare is improved, and there's a fee for those who choose not to have health insurance. Before I go on, I'd like to explain some terms used in American healthcare. Medicare is the healthcare for the elderly, in which you have to be above 65 years old or you have to be disabled. Medicaid is health care for the low income. Basically, you have to be below 133% of the poverty level. This is a map of the states who have chosen to expand on their Medicaid programs in 2013. Regarding the new benefits and protections offered by Obamacare, there is improved cost assistance. There are no annual or lifetime limits on health care, which means your insurance company can't drop you if you get sick or your forms aren't correct. You always have the right to appeal, and young adults are covered until the age of 26. Businesses with over 50 employees must give an option of health care, and small businesses with less than 25 will be given tax grant to give health care as an option anyway. Treatment is also equal for men and women with the new Obamacare system. To compare the American healthcare system next to Canada, Obamacare is multi-tiered, and the quality of care depends on how much you pay for it. It is not universal, and it's not nationally supported. There are some states who do not support Obamacare. There are less efficient cost containment methods. And now all of this may seem like Obamacare is a worse healthcare compared to Canada, but there are shorter wait times. With all the improvements that Obamacare has brought, there are still some issues. Young men and women who are not as needy of health care still have to pay a decent amount for insurance. Small businesses, although classified as having less than 25 employees, can go up to 250 employees and still have to cut costs, cut hours, and cut employees in order to provide healthcare insurance for their employees. Insurance companies and lawyers tend to benefit more than the citizens themselves, and overall healthcare is still expensive. It seems that the goal of making sure that everyone is covered ignored the fact of reducing overall healthcare spending, especially for the citizens. I've included a number of scenarios to help give perspective on individual Americans and how they are affected by Obamacare. Scenario number one, you have a 46-year-old mother of two who is part of a large business. She is uninsured. Now with Obamacare, she now has guaranteed options for healthcare and will not have to pay extra for being a woman. Her employer can even offer family coverage. Scenario number two, we have a 20-year-old university student who has severe allergies, and his insurance company is denying coverage of the allergy shots. With Obamacare, he's still covered even as a 20-year-old student and can appeal the insurance company's decision. Scenario number three, we have a 30-year-old entrepreneur who owns his small business of 51 employees. Notice how the 51, it's still classified as a large business, but in reality, it is a small business. He's affected negatively by Obamacare because insurance is expensive and will hurt the company. You may have to cut hours and employees. Scenario number four, we have a 29-year-old female doctor who is newly hired at a public hospital. Now, because of Obamacare and its spending being taken out of the healthcare system, there is a decline in wages, especially at a public hospital. Healthcare premiums are expensive, and the plus side is that she gets equal care because she's a female. As you can see, Obamacare is a big improvement, but it seems to have some issues. Healthcare is always a work in progress. Thank you for your time, and I really hope you learned something about the American healthcare system.